Dr. Fisher here. This is another one of our frequently asked questions in our series for Fisher Traction. And this is going over our 30-day money-back guarantee. And we offered a 30-day guarantee in the aspect of we want you to thoroughly try out Fisher Traction on your condition, in your situation, for 30 consecutive days. And the protocol behind treatment for traction does take about a month. Now, most people will feel some immediate relief, which is awesome, and we hope that happens. But many people may not feel immediate relief, but what will happen is as they use Fisher Traction consistently and frequently, day after day, week after week, they will start to notice a gradual change, which is really, really important because many of us suffer from chronic, long-term situations that there may not be anything that offers that immediate relief, and it's going to take a slower, longer change because it's taken years for it to develop. So when we talk about our 30-day money-back guarantee, think of it more as a trial. The number one key to the 30 consecutive days of using Fisher Traction is this. One, we want you to use Fisher Traction every day for 30 consecutive days, okay? Every day for 30 days. And what that does is every day for 30 days allows you to create momentum, and it is gonna force change in your spine in whatever situation that you have in your neck or low back. So a really important part is you doing it every day so you, one, learn how to use it, when to use it, how long to use it, and it becomes a skill. But you are really truly testing out, is traction gonna work? You're gonna know, if you use it every day for 30 days, you're gonna know at the end whether it is helping you or it's not helping you. To measure your improvement, I offer up these categories that we use in our office with our patients. One, on a scale of your pain from 1 to 10, 1 being the most minimal, 10 being the most severe. So in the very beginning, when you first start to use Fisher Traction, you wanna ask yourself, where does your pain rate on a scale of 1 to 10? Then 2, how frequently is your pain happening? Is it happening every day? Is it every other day? Is it every week? Is it happening once a month? That is really key to monitor and document in the very beginning and compare at the end of your treatment cycle. How frequently and how often is your symptoms occurring? Then third, the duration. How long does your symptoms last? How long does your pain last? Does your pain last for minutes, hours? Has it lasted for days? Okay. Or maybe your numbness or tingling, has it lasted for minutes, hours, or days? Your fourth area is the location, the area, the distance. So let's say if you're having neck issues, how broad do they cover? Do they radiate down in between your shoulder blades? Do your symptoms go down your arms and your hands? If it's your low back, are they going down your legs? Like with sciatica, are you getting numbness and tingling? How far away and how broad of an area are you noticing your symptoms? Okay. And then lastly, you want to monitor the nature or characteristic of your symptoms. It may not just be pain for you. You may have numbness, you may have tingling, you may have muscle weakness or loss of body function. You may not be able to move properly. You may not be able to do your normal daily activities, exercise, work. It may affect your sleep. So then when you've kind of given yourself a full understanding of where you're at when you first start to use Fisher Traction, what you want to do is you want to monitor each one of these categories over time, week by week, over that 30-day period of time, and watch the numbers and see if they change. That's how you're going to know. You're going to be able to measure yourself. Are you truly improving? Is your pain scale going down from, let's say you started at a 6 and then you end after 30 days, you're down to a 2 or a 1 or maybe a 0, let's hope. The frequency of your pain, is the frequency decreasing? Is the duration decreasing? The location, is the location getting smaller? Is it moving back up your legs or up your arms, getting closer to your spine? So is the area kind of closing down and getting tighter and smaller? And the nature of your symptoms, how are they changing? So it may not be that immediate, relief of pain or your symptoms. You may not experience that right away during this 30-day period of time with traction. And that's why we want to give you that full 30 days to use it, to try it, experiment with it, find out what seems to work best with you, and see how traction, if it can at all, affect your condition. Another reason behind our 30-day rule of thumb that we use as practitioners is that we're testing out whether or not conservative care can help your specific situation. If after 30 days, you've been using Fisher Traction every day consistently for 30 days and it has not helped you at all, or by chance, if you are worse, then the likelihood that your situation is more severe than anything that conservative care can help, you need to see an orthopedist or a medical doctor to get evaluated further, possibly get an MRI to determine whether or not your specific situation might be a surgical case. Hopefully it's not, but as a rule of thumb, if conservative care is consistently used over 30 days and you're not improving, or by chance if you are worse, you need to go to the next level and get checked out just to make sure. Now, I've tried to help in making this a little bit easier. I know some patients have difficulties in their mind figuring out if they are improving, if they are feeling better. So I've tried to make this simple in allowing the numbers to tell you whether or not you're improving. Because as we know, numbers don't lie. So if you take all of these different characteristics of pain and you're using numbers to measure whether or not you have pain on a scale of 1 to 10, how frequently, like how many days, 1 day, 2 days, 3 days, duration of time, maybe the location, you can measure the location. If you're using numbers to monitor and measure your improvement, it really can help you in determining whether or not you are improving with traction or any treatment at all. But numbers help, numbers don't lie. So hopefully this helps you in monitoring your progress and testing out to see whether or not traction can actually help you and your problem.